Hello everyone. Today we will be discussing one important topic that is abortion. So abortion is legally defined as the premature expulsion of fetus from the mother's womb at any time of pregnancy, before full term of pregnancy is reached, before full term. So it is premature expulsion of fetus from the mother's womb at any time of pregnancy before the full term of pregnancy is completed. So this is the definition of abortion. Now there are various classifications. So the classification abortion can be natural or can be artificial. Natural abortion is further classified in whether it is spontaneous or accidental, and artificial abortion is further classified into therapeutic or criminal. So this is the basic classification of abortion. Now the natural abortion. So natural abortion is seen in 10 to 15% of all pregnancies, and it is most commonly seen in second or third month of pregnancy. Second or third month of pregnancy. Now there are various causes of this natural abortion. So what are the common causes? First and the most important, that is in first trimester is the defect chromosomal defects. Now maybe other causes may be like developmental defects of fetus, developmental defects. There may be RH incompatibility, RH incompatibility. There can be some mucosal uterine fibroid, submucosal uterine fibroid. There can be the other malformations in uterus. So malformed uterus is also responsible for these kind of natural abortions. Now there may be the mother may be having diabetes, there may be syphilis or heavy metal, arsenic or lead toxicity, various drug intoxications are also responsible for natural abortions. Now the artificial abortion. So artificial abortion is the further divided into two parts, that is therapeutic or legal, and second is criminal abortion. Now this legal and therapeutic abortion is only justifiable if it is done in good faith to save the life of women. Only justifiable if it is done in good faith to save the life of women. And the world Medical Association adopted a resolution on therapeutic abortion, and that is known as Declaration of Oslo. So, Declaration of Oslo is related to therapeutic abortion. That is the resolution adopted by World Medical Association. Now, the second is the criminal abortion. That is the induced destruction or expulsion of the fetus from the womb of mother, and that too unlawful. So, this is unlawful, and it is induced destruction of fetus and expulsion of fetus from the mother's womb, that is known as criminal abortion. Now, this therapeutic abortion is covered under various rules and regulations under Medical Termination of Pregnancy Act. Now, we will be discussing the criminal abortion in detail. So, the criminal abortion can be procured by various methods. So, the methods procuring criminal abortion. So up to the end of 1 month, up to the end of first month of pregnancy, violent exercises, violent exercises, hot bath, or use of purgatives can cause abortion in first month of this pregnancy. Up to second month, abortion can be caused by use of abortifacient drugs. So abortifacient drugs are responsible for abortion in second month of pregnancy. Now about third or fourth month, third or fourth month, the mechanical interference is responsible for the abortion in third or fourth month. So first month violent exercises, hot bath, or use of purgatives. Now the second month use of abortifacient drugs, and in fourth to fifth months various mechanical interferences are responsible for causing this criminal abortion. Now the little bit about this abortifacient drugs. So these uh, abortifacient drugs, so they either produce congestion of the uterine mucosa, then uterine bleeding. So either they can produce congestion and produce uterine bleeding, and therefore followed by contraction of uterine muscle and expulsion of fetus, or they can simply cause uterine contractions by stimulating the myocardium directly. So drug basically uh, acting directly on the uterus. So drugs or abortifacients drugs acting directly on the uterus can be ecbolics or immunogogues. Immunogogues. Now, what are ecbolics? Ecbolics are the drugs which increase uterine contraction but do not relax the cervical canal or external os. So they are responsible for increasing contractions. Now, the most common ecbolic is the ergot, is the most commonly used and has uterine action uh, which increases as the pregnancy advances. Now, the main side effect of this ergot is toxic circulatory side effect because it causes gangrene due to arterial spasm. So this is the side effect of ergots. Now, other drugs can be used as alcoholics like quinine. Quinine can be used like the pituitary extracts. Pituitary extracts. Now, lad itself can be used as the alcoholic. One, the metabolite of lad that is known as lad oleate, or otherwise known as diacylon, that is commonly responsible for causing tonic contraction of uterus, and it is having some direct effect on the developing cells of ovum. So that's why it is used as ecbolics. Now the immunogogues. Immunogogues are the drugs which increases the menstrual flow. So these are the drugs which increases menstrual flow, and they act as abortifacient when given in large and repeated doses. So large and repeat dose is required when to induce criminal abortion. The chief drug, the immunogogues commonly used are Savin, borax can be used. Now apiol can be used. Apiol, estrogen, estrogen itself is responsible for increasing menstrual flow. Now, sanguinarine. Sanguinarine is also immunogogue which acts by increasing menstrual flow. Now, these are the drugs, the abortifacient drugs, which acts directly on the uterus. They can be ecbolics or immunogogues. Now, the drugs which acts indirectly, like irritants of genitourinary tracts. So, irritants of genitourinary tract. So they basically produce a reflex uterine contraction. So reflex action is there. They produce reflex the uterine contractions, and the main drugs are canthrides, potassium permanganate, and is basically these are the two drugs which are applied on the vaginal vault, and this they can be in solution form or they can be in tablet forms, and they causes basically punched out ulcers with the granular base, so ulcer formation, and thus responsible for reflex uterine contraction, thus causing abortion. So irritants of GUT. Now the second is the irritants of gastrointestinal tract, GIT irritants. They basically produce irritation of colon and hyperemia and contraction of uterus, the reflex contraction. In the irritants of the gastrointestinal tract are the canthrides, same as GUT. Now, on the magnesium sulfate can be used, alloys can be used, calomel can be used, mercury compound are also used. Now, other are the castor oil or senna. So these are common. The irritants of gastrointestinal tract. Now, these are the drugs which causes a local effect and thus reflex uterine contraction are responsible for criminal abortion. Now, the drugs having poisonous effect on the body. So, overall, on the body, if drugs are having poisonous effect on the body, they can be inorganic irritants, inorganic, or can be organic irritants. Now, among inorganic irritants, there can be metabolites of lead, copper, iron, mercury, antimony. Their metabolites are the inorganic irritants which are having general toxicity on the whole of the body. Now, organic irritants can be the canthrides, canthrides can be unripe papaya fruit, can be pineapple, simply seeds of carrots, juice of calotropis, or saffron. So these are organic irritants which are responsible for abortion, which are having general toxicity on the body and thus causing abortion. Now the effect of general violence. So general violence can be due to direct effect or indirect effect. Maybe due to direct blows or kicks, or due to some trauma to pelvic organs or direct trauma to uterus and adnexa, or they may be due to severe pressure on the abdomen. So that is the as a result of effect of general violence. Now, various violent exercises like horse riding, maybe cycling, jumping, or running. So some violent exercises are also responsible for the uh, abortion. Now something is known as cupping. Cupping. So what is cupping? Cupping is the method of criminal abortion in which the mug is turned mouth downward over a lighted wick, and it is placed on the hypogastrium. So a mug, the inverted mug, is placed on the hypogastrium with the lighted wick in this mug, and when mug is pulled, which result in partial separation of the placenta. So when someone pulls this mug upward from the hypogastrium, it responsible for partial separation of placenta. Because of this pulling, because of negative pressure is generated due to that lighted wick in the mug. So it is usually practiced in advanced pregnancy. So this was the method, or this is the method which is used in advanced pregnancy, and this is known as the cupping. Now there are various methods among general violence we have discussed. Now something about local violence. So in the local violence, uh, methods and results depend on the skill of operator. So first is the syringing. Syringing. In syringing, one special syringe that is known as Higginson's syringe that is used. Uh, Higginson's syringe is having a suction valve is placed in the bowl of fluid, and pressure is applied on the bulb. So basically, this is the bulb of a Ginson syringe and the suction valve is placed in the bowl of fluid, bowl of fluid, and pressure is applied on the this bulb. And now, imperfect filling of the bulb, due to imperfect filling of this bulb, and the mixture of air and fluid is forced into the uterine cavity. So this is the uterine cavity. So the fluid and air forced into the uterine cavity, and the uterine cavity, the pressure is higher than the pressure in the uterine vein. So this pressure is higher as compared to the pressure in the uterine vein, and the fluid detaches the parts of amniotic sac and placenta from the uterine wall. Thus, this pressure difference is responsible for separation of placenta and uterine wall, and thus responsible for hemorrhage, uterine contraction, and abortion. So this is the method that is known as syringing. Now, there may be some irritating substance may be added to the water, like corrosive sublimates, alum, potassium can be added, formalin, lead, and arsenic compounds can be added to increase the effectiveness. Now, sometimes excessive tissue destruction and hemorrhage. So it causes extensive tissue destruction and hemorrhage. And in early pregnancy, the antiseptic fluid may enter in the peritoneal cavity via fallopian tubes, and it is responsible for the shock or chemical peritonitis. Shock or chemical peritonitis can be seen in early pregnancy. So, and the rough insertion of the syringe into the cervix. So, uh, if someone inserted the syringe very roughly, so it causes the death due to vagal inhibition. So, various causes of death. There may be tissue destruction or hemorrhage may be there due to local violence. Shock or the chemical peritonitis may be there in early pregnancy, and sudden death due to vagal inhibition due to rapid insertion or insertion of cold or unduly hot fluid. So this is the method of local violence that is known as syringing. Now the second method is the rupture of membranes. Rupture of membranes. So, ruptured, it can be done by some instruments like uterine sounds, some probe, or simply by pencil. So it can be done by some probes, pencil, or the uterine sounds, and by introducing them into the uterine cavity. Now, abortion usually takes few hours to 2 to 3 days. So abortion takes few hours to 2 to 3 days in case of this rupture of membrane, and there is escape of liquor amini, but occasionally and the escape is slow, so it can take days to weeks also. So rupture of membrane is also under local violence. Now the third is the dilatation of the cervix. The third method is the dilatation of cervix. So that can be done by foreign body left in the cervical canal. If we have left some foreign body in the cervical canal, that is responsible for the dilatation, slow dilatation of cervix. Like the foreign body can be the pessaries, they can be pessaries, can be luminaria tent. They dilate the cervix, they dilate the cervix and irritate the uterine mucosa and produce the marked congestion and contraction with expulsion of fetus. So these are various foreign bodies that can be introduced and which are responsible for dilatation of cervix. Now, this method, the insertion of foreign body, is usually done after eighth week of pregnancy. So it is done after 8th week of pregnancy in nulliparous women, especially, and in case with rigid cervix. If cervix is rigid, then only it is used. And the what happens? These spongy foreign bodies swells from moisture in the uterine segment with expulsion of fetus after dilatation of cervix. Now, sometimes the slippery elm bark, the slippery elm bark can be used for this same purpose. From this was the tree which was grown in the Central or North America, the slippery elm bark, and the pieces are cut in to the desired length and breadth and inserted into the cervical canal. The similar technique or the procedure that they absorb the moisture within few minutes and jelly-like layer is produced on each side of bark and responsible for dilation of cervix and thus reflex contraction and expulsion of fetus and thus criminal abortion. So this is the method that is known as dilatation of cervix by insertion of various foreign bodies. Now, the abortion stick sometimes can be used for local violence. This is a thin wood or bamboo stick of 15 to 19 centimeter long bamboo stick or simply a thin wood. It is basically wrapped around at the end and for the greater portion of its length with cotton wool and piece of the cloth. So this is the stick which is wrapped around at one end with the cotton wool or the piece of the cloth or soaked with the juices of some irritating substance like marking nut or calotropis or the various paste made up of arsenious oxide or mercury sulfide or red lead. So these are irritating substances which are placed on this one end, which is wrapped with a piece of cloth or simply the cotton wool. Now this stick is introduced into the vagina or the uterus, os of the uterus by the abortionist and retained for some time till the uterine contraction begins, and it is responsible for contraction and thus expulsion of fetus and thus abortion. Now, sometimes twig of calotropis or simply the twig made up of Nerium odorum can be used as abortion stick. So, abortion stick is also a method of local violence. Now, the simply the application of electricity can be there. Electricity application in which the negative pole is placed over the cervix. So negative pole is placed over the cervix in the posterior vaginal vault and the positive over the sacrum. So positive pole over the sacrum and negative pole over the cervix. It causes when the current is passed, uterus contracts and may expel its contact. So if when the current is passed, there is a reflex contraction and expulsion of fetus. So due to that contraction, there is expulsion. So this electricity can be applied sometimes. That is also comes under the local violence. So these are the various methods of criminal abortion we have discussed so far. Now we will be discussing about this methods of therapeutic abortion. So it is also one important topic, the therapeutic abortion, various methods of therapeutic abortion. So first of all, various drugs like mifepristone can be used. It is the drug basically which inhibits progesterone. It is the drug which inhibits progesterone. So it inhibits the progesterone and it causes the breakdown of endometrium and thus detachment of embryo from the uterine wall. And what happens after 36 to 48 hours? After 36 to 48 hours, this of mifepristone will give misoprostol, misoprostol, and this misoprostol uh, is responsible for produces uterine contractions and thus expulsions within few hours. So it produces uterine contractions and expulsions within few hours. So mifepristone and misoprostol are the drugs which are used for therapeutic abortion. Now various derivatives of prostaglandins like prostaglandin E2, prostaglandin F2 are basically responsible for induction of labor and abortion, and they can be given IV or orally. So these are the derivatives of prostaglandin which can be used for therapeutic abortion. Now, sometimes there may be manual vacuum aspiration. This is the technique that can be used for therapeutic abortion, that is known as manual vacuum aspiration. What happens in case of manual vacuum aspiration? A handheld vacuum syringe, a vacuum syringe. This vacuum syringe uh, fitted with a plastic cannula, is introduced into the uterine cavity, and this cannula moves gently up and down over all sides of uterine cavity, and the contents are broken up by aspiration. So this is the technique which is known as manual vacuum aspiration. So this is another technique of this therapeutic abortion. Now, similarly to the manual vacuum aspiration, there can be electrical vacuum aspiration, in which the it is basically in the first 3 months of pregnancy, the cervix is dilated and the cannula is introduced into the uterine cavity, and this cannula is moved similar to the manual vacuum aspiration up and down and over all sides of uterine cavity, and the contents are broken and aspirated. A similar technique as the manual vacuum aspiration, but this is electrically operated. So electrical vacuum aspiration is also can be done in case of therapeutic abortion. Now, the evidence of abortion. What are the evidence of abortion? So during post-mortem, there are various post-mortem findings which are suggestive of the criminal abortion. Now, what are the things which uh, are suspicious of criminal abortion? So, in case of criminal abortion, what we are going to note is that the female, the pregnant female, will be deeply cyanosed. Cyanosis will be present. Now, maybe some instruments or the drugs, the abortifacient drugs, uh, are found at the crime scene or the cervical or the uterine cavity, or there is disturbed underclothing, disturbed underclothing. There may be some fluid and soap or blood may be coming out of the vagina. Now, these the finding basically depend upon the mode of abortion. What was the mode of abortion is basically responsible for various kind of evidences or findings during postmortem, and the time which has passed between the performance and death. So it depends. The evidences basically depends on the time that has passed between the act and the death. The act and the death, and second is the method used. Method used. Now, the expelled material, the material that has been expelled from the uterus, has to be examined for the product of consumption. So the material should be examined for POC, and vaginal content are removed by the pipette and examined for the chemical examination, sent for or preserved for chemical as well as for microscopic examination of vaginal contents. Now, uh, the duties of doctors in criminal abortion. So, duty of doctor in case of criminal abortion. First is the professional secrecy. This is the first and foremost duty to maintain all the secrets related to that patient, professional secrecy. Now, professional consultation. If doctor is having any doubt, there should be proper consultation with a professional colleague, and doctors must treat the patient to her best ability, to his or her best ability. The treatment should be proper and to the best of his ability. If the condition are serious, there has to be proper arrangement for dying declaration, and if the woman dies, so doctor should not issue death certificate, death certificate, but doctor should inform police regarding the case. Now, the criminal abortion, there are various causes of death. So, what can be the cause of death in case of criminal abortion? First is the immediate cause, that can be vagal inhibition, that can be air embolism, that can be severe hemorrhage, that can be fat embolism, that can be amniotic fluid embolism, and rarely some kind of acute poisoning can be responsible for this immediate cause of death. Now, the second is delayed death, can be seen due to septicemia, can be seen due to pyemia, can be seen due to tetanus. Now, remote death in case of criminal abortion can be due to renal failure, bacterial endocarditis, or pulmonary hemorrhage, pulmonary embolism. So these are various causes of death in case of this criminal abortion.